4:33 p.m. I really hope that the recording will capture the screen. In the last few meetings, we had a hard time and it was just capturing audio, which is still fine, but I want to make sure it's captured the screen. I believe all of you guys received an agenda yesterday and some attachments. Maybe before we even go into the agenda, I just want to summarize the discussion we had with the administrative committee on Monday night. If you guys recall, when at the beginning of this pandemic, we weren't really allowed to meet in groups, so we didn't have our March committee and board meetings, and it took the legislators approximately 6 weeks to meet and pass, I guess, an emergency rule to allow public meetings to take place virtual, like what we do. So at that time, when that came up, there were also from the AG office and attorney auditor of state office, I guess, some guidance or best practices on how we should conduct these meetings. I want to make sure that everybody knows that by law we are allowed to have these meetings until December 1st. So December 1st, which is a month and a half, is when this emergency ruling will end. But we believe that the state legislators prior to that will meet and vote to probably extend this. There are a few options. They either meet to extend this, or two, they might actually make some sort of virtual meetings permanent for public bodies. We don't know that yet. I guess worst case scenario will be for them not to meet, and then really the only option will be for our December 3rd meeting is to meet in person. By saying that, I would also like to mention that when we decided to come back in April, we decided to use all best practices they were recommended by the AG office. And one of the best practice was that we do a roll call for every motion. And the reason for that was to make sure that if somebody is on the phone, and for us to be able to consider them that they participated in the decision and voted, we wanted to make sure that, again, we conduct roll call just in case, let's say, their phone is disconnected. So we want to make sure we don't lose anybody off the line. At that time, us as a group or you guys as a board agreed to those practices. After a few months, we realized that due to the number of motions, it takes quite a bit of time to do roll call. So what we did at the last board meeting, we actually combined some of the motions that we believe cover the same topic. So we might have a longer motion, but we don't have to do as many roll calls. So instead of having 20 motions at one particular board meeting, now we maybe have only 10. However, there are still a few board members that say, hey, I think there are other options to just roll call. Maybe we don't have to do roll call to every motion. And what I did, it's actually kind of matching the training we conducted after our last board meeting. I'm part of a number of public meetings, and I'll tell you that everybody does it a little bit different. But again, we wanted to make sure we use all the best practices. So I went back to the AG office. I went to their director of public affairs. His name is Mark. I met him around a year ago. He's actually the one now amending, changing, and looking at Ohio Sunshine Law. And again, I had the pleasure to meet him around a year ago, and I have been in touch with him since. And he's kind of connected to some leaders in Seneca County. So every time I have a question, I say, hey, Mark, what about this? And I did send him 2 questions. And I just wanted to share this with you guys and then tell you what the admin committee decided. One was, there were actually a few public entities in our communities that when they promoted, but when they shared the information to the public, hey, we have a board meeting coming up, their message in the newspaper was, so and so and so has a board meeting on Monday night at 6:30 p.m. If you want to know the phone number, how to call in and participate, email us at this email address. And I told Mark, I think this is a violation of open meetings. I don't think you can allow, or you should make the public take an extra step just to find out the phone number or the Zoom link. He said, that's a great point. I think I'll agree with you on this one. These virtual meetings are so new that it's still a lot of gray area. And usually until a judge rules on it, somebody brings the issue to the table, everybody kind of still does what they want to do, but he didn't recommend me to do that, and he recommended us to make sure that the phone number is there out to the public, and we don't make them do an extra step. By the open meetings, I don't think we can require the public to identify themselves to join the meeting. Therefore, we shouldn't ask them to send us an email. Okay? There are very, very special cases where you should have them identify themselves. For example, there was a public body that had a meeting inside the juvenile detention center, and due to safety and security reasons, at that time they were making the public identify themselves. Well, the second question I asked him is, hey, Mark, do we need to do a roll call? I know there are public bodies, they say, hey, everybody raise your hand if you agree, and everybody raise their hand. Anybody opposed? Raise your hand, and nobody raises their hand, and you say, okay, motion passed. And he said that two things. He said that if you have all of your board members joining the meeting virtually, audio and video, you could, for some of the motions, you could just say, hey, all in favor with this motion that's on the table, please raise your hand. And then we see everybody raising their hand, and then I count, and I see that we have 14 hands, and that appears that nobody's opposing or nobody's abstaining, and we can say, okay, motion pass. The question is that if you don't have everybody joined by audio and video, again, would be hard to kind of know or see that they are raising their hand. So he also mentioned that if there are significant financial matters, such as passing a budget, he continues to recommend roll call for those motions. So now wrapping up, again, talking with the admin committee Monday night, and knowing that not everybody maybe can join through the webinar or through the camera during board meeting nights, the admin committee recommended that we keep roll call for every motion. Again, if we feel that everybody's on with the camera on and live, and we can see them and they can see us, it shouldn't be a problem to say all in favor, raise your hand, and then we count the number of hands. And if the number of hands don't match a number of board members present, then we figure out who's abstaining or opposing the motion. So again, until then, we'll try our best to combine some of the motions, as well as long as the topic it's somehow similar, but we'll continue to do roll call. Any questions about what I said? And I'm gonna close my window because it's a little loud. No questions. Okay. Right after the last board meeting also, I'm not sure how many of you guys read, but I thought we had a great actually training at the last board meeting at the end about Robert's rules and a little bit of Ohio sunshine. But I also send you guys some information about Ohio ethics. I actually sent you guys, I believe, 3 cases that Jimmy Young, for example, Monday night said, man, there were really some great cases you shared with us. I'm not sure if you guys had a chance to read them. If you didn't, it's not like an emergency, but I recommend maybe in the next few weeks, few months, maybe you read them. One actually pertained directly to our board when the juvenile probate judge Meyer used to be our board attorney. Any questions about that or discussions? Okay, I'm moving on. First item on the agenda is the calendar 2021 meeting dates. I sent you guys, I believe yesterday with the email, this piece of paper, the calendar where again we plan the meetings a year ahead. In the past, there were times where I gave you guys 2 options and tell you guys, hey, which one do you guys like best? And then we were debating for 45 minutes, and most of you guys recommended me last year, you know what about you just give us 1 option? So now I'm giving you guys only 1 option. So it's honestly, it's almost identical to what we have this year. July will be a month off. Due to the holidays, we are merging November and December together as we usually do. So middle of November, early, we have the committee meetings, and early December, the board meeting. We have total of 10 board meetings. One thing we don't have here is the board training. We like to schedule annual board training, but because again, so many are certainly uncertain with COVID and this pandemic. We just put TBD on it, and probably what we'll try to do is really try to do what we are doing next month. Maybe 1 month combine the two coalitions to meet together, and the other time we're going to do a training. So please, I'll put in my letter Friday, but please keep in mind and remember that I believe Monday the 16th of November we have that ethics training. Very, very important ethics training. I think you guys are going to really enjoy that. And then Wednesday, I believe is the 18th of November, is which will be the last committee meeting of the year. We'll have it combined between the administrative committee and the program committee. Any questions? Is 4:30 p.m. do you guys think gonna still work for majority of you guys? Has been 4:30 probably for the last 25 years, but unless you guys have some major issues, I think we'll stick with it. Okay. Go ahead.
When did you say you said that they were going to combine the administrative and the program committee in November?
Correct.
Is that what you said? What day is that?
I think it's Wednesday, November 18th.
Okay. That's what I thought you said. I just wanted to make sure. Thank you.
Yep. So yes, again, I'll put in my letter Friday, but Monday, November 16, 4:30 to 6, we have an ethics training that was already approved by the Ohio Department of Mental Health. And then Wednesday, November 18, we'll have our last committee meeting of the year. And at that time, we'll invite the admin committee board members to join you guys for a combined coalition, combined committee. Any other questions? All right, we are moving on. We received and entered into our second year of the federal SPF PFS grant. This is a 4-county grant with Sandusky, Seneca, Wyandotte, and when we apply for this major grant, we also included Huron. Mainly we included them because we are the fiscal officer for Huron County Board right now, have been for the last 2 years. So for us to have a better, I guess, opportunity to bring this money to our communities, we included another county. So this was a federal grant. It covers 4 counties. We obtained it. The lead agency, Sandusky County Health Department, they are giving us as a board $30,000, $40,000 a year, actually. That I believe you guys approved at the last board meeting. And usually we keep most of these funds, but then we contract out some for services specific to Seneca County, and Wyandotte County FCFC does Wyandotte County. So again, we receive our contract, we sign it with the health department for $40,000. In return, as I said, usually we turn around and contract out some of our money with our prevention connections organization, which is our prevention agency in Seneca County. So we are proposing the same contract amount as we had in the last fiscal year of $8,000 out of this federal prevention grant for prevention connections for services specific to Seneca County. Robin, anything you want to add here? Okay, she's nodding her head no. Any questions for any of you guys? This is a total of 4-year federal grant. It's a lot of data collection. It's a lot of community surveys. We are really kind of, Seneca and Sandusky are kind of taking the lead, and we really guide Wyandotte and Huron to bring them up to speed. But just to give you an example, again, we're really working on data collection. We're really working on doing what's it called, a windshield survey. So you have individuals that go in a community and try to survey kind of what you see about alcohol in a community. We try to work with all the alcohol license establishments in the county and see if they need training for people who serve alcohol, if they need proper training on how to ID, if they need proper training maybe to know how or when to stop serving alcohol to somebody because maybe somebody had too many drinks. So, it's this kind of work, it's kind of building capacity in the 3 counties that these prevention organizations are doing. If you have any questions, please let me know. If not, again, we will propose $8,000 for Prevention Connections for federal fiscal year 2021. No questions, okay? Robin, I think you are going to take the lead on the next 4 or 5 items.
Okay. The next one, the Indigent Hospitalization Reimbursement Program. This is a new program to us. It's actually only a 3-month program, and I'm trying to understand everything around it. But they're funds that are a result of the impact of COVID-19 onto our behavioral health system. And it's coming to us because OMAS, as a recipient of the CARES Act funds, is deciding to allocate funds to the boards to offset expenses that boards are accruing as a result of bed availability decreasing at the 6 state hospitals. So what happened is when the pandemic hit in March, the state hospitals began to experience a 40% decrease in their beds being available because they needed to make arrangements on their units to allow for people to be quarantined. And due to this decrease, what happened is then there was an increase in the usage at private inpatient stays. And what happens if somebody goes up to the state hospital, the board and the providers, they don't pay directly any funds for people to be at the state hospital. But if they go to a private hospital and these people are indigent, then the board, in our scenario, reimburses, usually it's Firelands, to make sure that the indigent care for that individual is in place. And so these funds are meant to reimburse the board and the provider for those expenses that went up because of the civil beds not being available as much at the state. So the funding period for this is chosen to be October 1st. So this month through December 31st. So again, it's not a long term, it's just 3 months. And they used a formula based on historically the utilization for civil beds at the state hospital, and for our board, based on that formula, we're granted up to $20,547.43. Now, we can tap into these funds and be reimbursed for $750 per day for up to 7 days, including any professional fees or transportation costs. So if a person needs to stay beyond the 7 days, then we have to go into a clinical review and request and justify additional dollars. But from the beginning, it's usually only up to 7 days. So our local plan is to have Firelands use these funds to pay for adult private stays at One South, and then for adolescents, any cost for them to stay at UTMC. What Firelands has to do is they have to submit a weekly form to the board, and then we have to submit that to OMAS to seek any reimbursement of these funds. Then once those funds are approved, it'll be sent to the board, and then we'll send it on to Firelands. Again, these are one-time funds, and they're only for the 3-month period, and we have no indication that they'll be renewed beyond that. Any questions?
I think here we might have to do a motion to accept the credit from the State Department, and then we'll take those 20,547 and 43 and put them, encumber them on a purchase order. So once we have these indigent clients in inpatient mental health private institutions across the state, then we can issue those payments up to $750 a day. And again, we believe obviously we're going to use the money by December 31st, but it might not necessarily be a contract with a particular agency. We're probably just going to encumber the funds on a purchase order. Any questions about that process?
These funds are only to be tapped into, obviously, once the hospital and Firelands has determined that the person does not have insurance, their own ability to pay out of their own pocket, and obviously Medicaid insurance. There's no questions on that. I'll move on to the next three items, and please just bear with me because this is involving three grants that we have or hope to have. And it's been a very confusing year as far as these grants pertain. So the board's been a recipient of the State Opiate Response Grant. This is also known as the SOAR 1.0 grant. And we most recently received that from September 20th of 2019 through September 29th of this year. And under normal conditions, what would happen is the SOAR 2.0 grant would have become available September 30th, and we would have just gone from ending one grant one day and starting with the new year the next day. But due to the state not receiving their notice of award from the federal government on this grant, OMAS is doing what they call a SOAR 1.0 no-cost extension of funds to cover the lapse of grant coverage between SOAR 1.0 ending and SOAR 2.0. So again, normally 2.0 would have started September 30th, but because of that delay, that one's not going to start until I believe it's December 4th. So they want to try and cover the programs and services that were under the grant to make sure that they just don't go unfunded for that 2-month period. So they're calling it a no-cost extension. And it can only be used for projects not or that are already approved under the SOAR 1.0. So after reviewing SOAR performance, and there's some supplanting issues and funding needs, we anticipate only needing to fund our Lotus home under this. Right now we have 3 projects. We have the Lotus Recovery House, we have the REN program with RAS, and we have the male recovery house, the cottage, under New Housing Ohio. But when we look at everything, the only thing we believe we need to have covered under this 2-month period is the Lotus House. Now, what the state did is they're telling us we have $26,455.68. They took that number and gave it to us based on what they thought we would need to cover all of our projects. Right now, because we only think we need to apply for the Lotus House, we're looking at approximately $15,000 to ask under the SOAR no cost extension funds. At this point, we don't think this month we'll have any board motions on this grant, but we'll be confirming things in the coming weeks on our application and knowing for sure what we need. But again, I hope I explained that in the most simplest way. And what I can do next is go into the SOAR 2.0 grant, which would be the next. So the state receives the money from the feds every 2 years. So it's our 3rd year, but it's the state's 2nd year with the feds. So that's why it's called SOAR 2.0. And it's the RFP has recently been released, and we were reviewing the application guidelines. There are a few changes this year, including the ability to treat persons with a stimulant disorder. So before, under SOAR 1.0, we could only serve individuals with an opiate disorder or usage. Now we can include anybody with a stimulant disorder as well, and that would include anybody with meth or cocaine use disorders. And so the other change that they've included this year is we can include prevention services. So previously, the only thing we could do under this grant was treatment and recovery supports. Now they want to include prevention to try and help us make sure we're doing a full continuum of services. They haven't said exactly how much each board area can apply for. But for us, they estimate that we could apply up to 500,000 for this, which is a lot more than we've applied in the past. In the past, we've been anywhere from 114 up to 200 and some thousand. So this is a lot more money available to us, but we do not have to. Again, they're basing things on estimates, and that's where they think we might fall in. They're federal funds, so there's several requirements that an agency must be able to comply with. And so Mircha and I will be making some decisions on recommendations in the coming weeks as far as which agencies can meet these requirements and what we would like to include on the applications. The state's really encouraging everybody to find new partners, but there's some need for some clarification because they really encourage, for example, boards working with faith-based organizations. But in the past, we've had some concerns with those type of agencies being able to meet the strict federal requirements. So that question has been asked by another board as far as how do we make sure we're compliant and still work with these newer partners. So we're waiting on an answer with that. I think that's all I have on that one. You still with me on SOAR 1.0, no cost extension, and 2.0? Okay.
This is Pam. Do we have a use it or lose it clause? Because a lot of times with federal government grants, you get a use it or lose it.
Are you referring to the 1.0 no cost extension?
Either or, yeah.
Yeah. For the 1.0, when we ended it, we were just under 4,800, and that's okay. They're okay if we haven't used it. So yeah, it's more of a use it or lose it, and it goes back into the pool of paying for everybody's money under the no cost extension or under 2.0 to other boards who could use it.
Hey, Pamela, yes, you are correct. If we don't use it, we are losing it. And it's very similar to some of our state allocations. And Monday night, the committee made recommendations to approve uncompensated care during the board meeting. So that's a motion where we approve, I guess, additional funds to some of the providers. I guess the easy way to explain that, let's say we have $1 million to give to providers in our 3 counties, and we allocate all $1 million to 10 different providers, $100,000 each. At the end of the fiscal year, you might have 3 providers, then instead of using 100,000 of their contract, they use only 50,000. So now we are left to take their money that they didn't spend, send it back to the state. In our case, usually with our allocations, what we do, if we find that any of our other providers actually overexpended, so they have and they can show expenses on clients above their contracted amount, then we can reconcile and give them that amount that wasn't spent by other providers to avoid us sending money back to the state. Those are usually for allocations. For these federal grants, it usually is based on reimbursement. So they might tell us, hey, you have $200,000 for these 3 projects. Every month or every quarter, we use the money, so we have the expenses, and only after we have the expenses, we submit for reimbursement. But if we can't come up with $200,000 in expenses, and we come up only with 150, then we'll get only 150. So you are right. Ideally is all the money that they tell us you get initially is that we spend. It's just that what Robin says, sometimes there are so many rules, like you want to make sure you don't supplant. If you have a contract with an agency from different pots of money, you want to make sure they don't supplant that. And sometimes, unfortunately, we are at the discretion of the agency. Can they see the clients? Just because Fallen says, or Oriana House says, hey, I'm going to serve 100 clients with Vivitrol, and that's what we put in a grant. But at the end of the day, maybe they serve only 50, there's no way they can draw down all the money just because their projections were too high or something changed. And again, for all these federal grants, especially if it's treatment, the agency must first bill other paying sources such as Medicaid. So I might give Vivitrol to 100 clients, but out of 100 clients, 75 are Medicaid eligible. Therefore, I gotta bill Medicaid. And if I bill Medicaid, I should not also bill the grant. That doesn't make sense kind of what I said?
What?
Was it clear kind of what I was trying to explain?
Yeah. What I was, thinking about was when Robin said 500,000 we should project, and yet we haven't used anything near that. So that's why I was wondering, use it or lose it.
Well,
But thanks.
what's really interesting is that it appears that the federal government for this SOR grant is making more money available to the states than anybody projected. For whatever reason, we need a really heavy bag because a lot of cash is coming down from the federal government. I mean, it's just the reality. Unfortunately, in the past, they were very strict on what you can use it. And this is all AOD related funds. We can't take any of these funds and use it for mental health crisis services or for inpatient hospitalization or for mental health crisis services for children or trauma related services for children. So yes, that's a lot of money, and as Robin said, I don't think we'll have $500,000 to request in projects. And the other risk that a board needs to take, and I think a lot of boards are now concerned, is there's really no sustainability beyond 12 months. So now you work with all these providers, say, hey, hire 5 more people, hire 4 more people, let's get this going, and 12 months later, the grant doesn't come back to your board or your community. And now the question is how you're going to sustain all these new programs that maybe you implement now.
Yeah. Yeah. Thank you.
And Pam, just to further answer your question, like when you look at the no-cost extension, the 26,000 that they're offering to cover us during that 2-month period, that's coming from the pool of funds that they expect boards to have not used in their 1.0 grant. So they anticipate some funds simply just not being used.
Okay. Thanks.
You're welcome. So then the next one is our Matt Padoa grant. And this is a federal grant that the board received the last 3 years to address medication-assisted treatment in our district. So it's been used to make sure people who need Vivitrol are getting the Vivitrol and necessary treatment and recovery support services during that treatment episode. And we received $176,000 per year, with each year of the funds becoming harder for the boards to be able to utilize due to limitations on how the funds could be used. So what really happened, not just for us, but other boards that were involved, is, people's substances. This was very specific for opiates. And so when people began to use other substances such as alcohol or meth, these funds could not be used to treat those individuals. It was very restricted to the opiates. And so as a result, boards were not able to utilize all the funds. So OMAS has offered a 12-month extension on any remaining funds per board. So with SOAR, there was, SOAR 1.0 and then SOAR 2.0. There is no new MAT grant to fall into. So they're giving us a 12-month period to use any of the remaining funds because for us, this was a 3-year grant, but for them, with the feds, it's a 4-year grant. So they have 1 more year to try and use up all the funds and then get, everything to the federal government that they're required to have. So right now, we're currently anticipating $51,056.33 in remaining funds that we're in discussions with Firelands on their plan to utilize the remaining funds. So for these, we contracted just with Firelands for their mat services, and so we're just looking with them on a plan on how they could use these remaining 51,000 in the next 12 months. So in November, we'll be able to provide an update and ask for a board motion to enter into a contract, most likely again with Firelands for those remaining funds. We're just not at a point right now that we're able to do that this month. We have to put our application in and have it approved with OMAS and really figure out with Firelands what they're able to do in the next 12 months with those funds.
So, Robbie, none of these 3 grants you just talked, none of them will be as a motion during next week's meeting, but we are projecting a little update in the November committee meeting and then have the motions at the December, I believe is 3rd board meeting.
Correct.
Any questions?
No.
Robin, you want to go with the safety officer report that
Sure.
is next?
So once a year at minimum, we like to give the program committee an update on our safety-related items here for the board. So we'd like to give just a brief update this month and explain our plans to further address safety at the board office as well as Lotus. So Rose here at the office is the board's safety officer, and she provided with me an update that she's completed all the trainings and required inspections that we would need to do for calendar year 20 at this point, and she's up to date on everything. When it comes to the Lotus Recovery House, we have completed all our quarterly and annual inspections, which are due. We have one more to do this quarter, and we're on track. We'll get that done by December 31st. We did have some additional training this year. We did some training on CPR, first aid, communicable diseases, and Narcan. And really, we've always wanted to do the CPR and first aid, but having the Lotus House kind of helped facilitate these trainings along the way this year. So in an effort to further address our safety issues here, we're seeking some of these previously discussed grant funds to cover the expenses to install additional cameras at Lotus and cameras at the board office. This would include cameras covering the entrance, the parking lot, and the shed at the office. There would also be a feature to allow the board staff to monitor the site remotely and to speak directly to persons who ring the bell at the front door of the office. And this is important when, it's maybe early in the morning and the first person's arriving here and it's dark. This would allow some lighting and camera on the facility. Also, when only one staff person's here, we can see outside who's coming and who's approaching the office, as well as, just good customer service. If by chance none of us are here, which is, we always try to always have one of us here, but occasionally Rose may be the person at the office and we're at meetings or doing other activities and she's got to run downtown to the auditor's office. This would allow us to have a physical eye on the building should anybody come there. And maybe we're just a minute down the road and we can, tell that person, someone's almost there. So that's what we hope to be able to do in the next month or two to address the safety here.
Any questions? And Robbie won the CPR competition, just so you guys know. She scored the best.
Staying alive.
I did win though inflatable CPR mannequin. Okay, we're moving on. This is just best practices, no motion here needed. The next item on the agenda is the board bylaws. And yesterday in the email, and I sent it to the admin committee as well, you guys received the current version of the board bylaws. They were last approved January of 2015, and then you guys also received the draft proposed version of the bylaws. We don't have to act on it at the next board meeting, but we are planning to discuss it. If you guys have any questions or any other thoughts during the November committee meeting, and approve it at the December board meeting. Um, our bylaws can be amended by majority vote, but we also need to make sure that every board member has at least 14 days notice to review them. So this will give you guys plenty of time, way more than 14 days to review them. I will tell you that really there are not a lot of major changes, it's more cleanup, but I'll tell you the Article 4, which is almost the entire second page of the proposed bylaws. It's really good information for you guys to review once in a while. Talks about special meetings and quorum and how motions should take place and voting. Keep in mind though that some of this could change if the Ohio legislators will make some permanent changes to virtual meetings. We don't have that in the bylaws, but based on all the trainings I've been part of this year, I thought it's a good time for us to clean up a little bit some of our bylaws. I'm not sure if you have a chance to read them. You don't have to comment today. Again, you have a full month to ask any questions that you might have regarding the bylaws. Any questions? Another thing that we added into the bylaws that I think was important, and we covered it at the last board meeting, is as a public entity, we don't have to allow for public comments. However, it is best practices to allow for public comments, especially when there are open discussions about budgets. But on Article 4, Section 7 talks about public comments and talks about that with the chairperson approval, a visitor can make a comment not to exceed 5 minutes. So again, we wanted to make sure we keep that under control. We have been fortunate as a board to run pretty smooth in the last 10-15 years. We didn't really have a lot of public interference, I guess, with our meetings, especially in a negative way. But if that is to ever happen, you know, we do have some bylaws in place to guide not just you guys now, but the future board members. Any other questions? Discussions? All right. I do have 2 updates. And Robbie, you know, feel free to jump in as well. I'll maybe start to give a good summary, going back a little bit as we have some of newer board members. You know, in the last 3-4 years as a board, we were faced with some challenges regarding our local levies. You know, we had levies only in 2 counties. We could never pass a levy in Sandusky County. We passed a levy in Sandusky County, which was an amazing accomplishment. And as soon as we passed the levy, we realized that, oh my God, all 3 levies that we pass are not in accordance with the Ohio law, and we got to repass all 3 of them. So, you know, when we had the last strategic plan, really the main goal is like, oh my God, can we get to pass all 3 levies to have this financial sustainability? We can't really focus on any major project without having the funds available. We need to get to a financial situation where we feel comfortable investing into projects, and not just invest into projects, but have the sustainability in place to keep them long term. The good thing, I'll tell you guys, that we are here today. Even if we are in the middle of a pandemic, we passed the levies. We worked really hard with the finance committee to implement a reserve policy. We feel very good about where we are today, even if in the last year we invested more into some unexpected items such as telehealth due to COVID, but we still feel we are in a good financial situation. Friday in my letter, I'll put a little summary about that as well. So now we're looking at into this new strategy plan and new community plan that we implemented. There are really 4 or 5 projects that, we really wish to accomplish. And we work on, in the past, trying to implement mobile response, trying to enhance our crisis services, try to enhance services for children in multiple systems. We try to do a lot of innovative things, and it's always one barrier they will run into. I mean, almost every project we tried the last 2 years, we run into the same barrier. And people might think that the barrier is money or finances, but it's actually not. The main barrier is licensed professional therapists. We just have a major shortage of them. Almost every project we try now to work on that's, I guess, a little bit more difficult. Again, the issue is not necessarily getting the money, getting the grant, but we don't have the bodies. We don't have the credentialed individuals working for a community mental health to assist us implementing those projects. When I say it's a major shortage about licensed therapists, especially master level, I'm not talking as a whole, as the whole community, as much as I'm talking about community mental health providers. We have quite a bit of private practices in our 3 counties. They have master level therapists, but they run, their private businesses 8 to 4 or 8 to 5, Monday to Friday. Well, it's not really helping us. It's not helping us with individuals who are in and out of incarceration, in and out of the state hospital, who are, severely mentally ill, who are indigent, who are violent. It's just not helping us. Our crisis system, sometimes we run a very fine line, because we have at times only 2 individuals who can cover 24/7, and this is a really burden for our system. Around 6-7 years ago, we tried a partnership with a few other boards, just to give you a little bit more history, on a project with UTMC. At that time, there were some boards trying to recruit and retain psychiatrists from UTMC by trying to pay some of their loans or pay for their school, if in return they work in a board district for X amount of years. We were really close to implement that, but in reality what happened there, UTMC and the students didn't want to commit to any 5-year agreement to work in any particular board district. Now we look at the state shortage. We also had a few meetings with Fallens, and this morning I actually had a meeting with Heidelberg University, and we discussed with Heidelberg a few times, and as most recent this morning, how can we implement either a scholarship project or a loan forgiveness project for their master level students to help them complete not just their master program, but then complete their internship and also be able to receive their independent license, but then making sure that they stay and work within our community mental health system in a board district. So again, not into a private office that you work Monday to Friday, 8 to 4, but actually into our community mental health system. So the meeting we had with Fallens was really promising this morning. They are really excited. Fallens, I talked to them a few times, and I just left them a voicemail prior to this meeting. We need to clarify a few things. But this is one of the projects I wanted to give you guys a heads up. As personally as a director, I'm planning to bring forward probably at the next board meeting for a motion. My goal is for us, out of the funds that we have into reserves, set aside an amount every year for the next 4 to 5 years, where we can enroll some of these students through the master program. One of the things that we discussed this morning, can we start after the first of the year, maybe where we already identify somebody who's planned to finish their course May of 2021, maybe also identify somebody who August of 2021 they are halfway through their master course, and then maybe also identify somebody who in August of 2021 is just entering the master program. We also really talk to make sure that they stay and work in the board district, which is Seneca, Sandusky, Wyandotte, and not that funds can take them to Sandusky or Huron County or Ottawa County, but they have to stay and work in our board district. And we also talked about the need for minority workers. We have cities such as Fremont, where we really want to see African American and Hispanic or Latino therapists that can work in the district or into that area. So all those things were brought up to the table. and everything seems really promising. Uh, but I think that while this is an effort at the beginning, I think we'll be able to see the results 3, 4, 5 years down the road. And talking with Robin this morning, I don't know if we don't do this, how we can expect better results. I mean, our system is clogged. That's the best way I can say it. It's just clogged. We have projects that we develop with the judges, such as the AOT court, and with the state, and we have everything in place with even the judicial system or the local jails, but we just don't have the bodies. We just don't have the therapists that can keep to working within our community mental health system. And the reimbursement rates, especially Medicaid reimbursement rates, are just not high enough for violence to be able to provide higher salaries or higher bonuses. So in a nutshell, that's the project I wanted to describe to you guys. I'm having more meetings in the next few weeks and planning to give you even more. And then I'm planning to bring a proposal in front of all of you guys next month. Robin, or any of you guys?
Hey, so that's something that I'm kind of interested in. So I want to complete like my master's program for family nurse practitioner, but then afterwards I could go and continue my education and have more of like a focus in mental health. I would like to complete my family because then like it's more general, I have more options, but then in the future I could still go and continue on. Right? Or would you not be interested in something like that? Like, how could I apply for that? Like a scholarship or something like that?
Alex, the only thing that I think will be different with you, I think that this might be a conflict of interest because you're a board member if we handpick you as one of the scholarship recipients. I believe by Ohio ethics, the only way we can do any business with a board member, it will be they will have to resign, and it will have to be a 12-month wait period before we can even engage into any discussions with a former board member. But
Okay, yeah, I still have a year and a half for my current master's program, so it's not anything really soon.
Okay. Well, if you're really interested in this field, maybe we should have a side discussion. I mean, we'll hate to lose you as a board member, and as you know, there's just, we need to abide by Ohio ethics, and I'm glad you brought it up. I don't think, even if you are not a board member, I don't think we are in a situation to make any commitments or promises. But yes, back to your point, somebody in your situation could qualify. So again, we really like to work with local organizations. That's why we first started with Harbor University, as they have the program that will meet our needs. This time, Tiff University doesn't have the same program available for their students. But yes, to answer your question, somebody in your situation could qualify. Now, we don't have, again, all the details. There are two major things that we discussed. One is a scholarship program, and one is a loan forgiveness program. So somebody that, let's say, is planning to graduate May of 2021, we're probably not going to offer them a scholarship. We might have a contractual agreement with them and say, okay, this is a loan forgiveness. If we'll help you get your internship with our community mental health provider. We'll give you the supervision you need. You're going to start working for us. And at the end of each year you complete, we're going to X amount of money we're going to pay back towards your school loan. So we're going to go a hybrid model. We're going to identify some students for a scholarship and some students for a loan forgiveness program.
Bertha, did you talk to UT at all about this? They just don't have the same programs?
Well, with UT, the last discussion we had, as I said, was probably around 6 years ago. And there was a collaborative project with 4 other boards. We were all trying to go in with some large amount of money to recruit psychiatrists. And there was
I should have said Tiffin University, not Toledo.
Okay, you say, okay, got it. I didn't have these discussions with Tiffin University. No, I just know that right now they don't have the program. Now somebody told me, well, if you talk to them, maybe they develop it. Well, we don't have the money that I think gonna make it attractive for them to develop it. I mean, we're talking about 2 to 3 scholarships per year tops, or loan forgiveness program. So if we get to 3, we'll be very successful, but will most likely be 2. So I don't think that for 2 scholarships, Tiffin University will change their program.
I think a 5-year commitment afterwards is kind of what's scaring people, because that's kind of long, I feel like.
And we discussed that too. Really, what's interesting, our approach was talking with Heidelberg today is this is the idea of what you guys recommend. And actually, when it comes to the 5-year period, they said that they believe that's appropriate. They said that most of the loan forgiveness projects that I guess are there require sometimes up to 10 years. And I believe Heidelberg, when they had theirs, it required up to 10 years. So we know that I believe the first 2 years they need to have some supervision before they become independent. So by the time they become independent, they are already in year 3 of their commitment. So Heidelberg recommended the 5-year period as well. But we'll probably our goal is, once this is implemented, to meet at least twice a year and learn from our mistakes. And it doesn't mean that we can change some of the dynamics of this project year after year. So if we see that the 5 years is too much and we lose students, then go ahead, Polly. Polly, you are muted.
Me. Okay, now can you hear me?
Yes.
Okay. I have a question. Part of it you answered, that you approached Heidelberg on this, and it was a good, positive discussion. Have you thought of looking at other professions other than other people in professions who might be interested in moving into mental health, or that are already mental health work people, such as nurses? Have you thought about, I don't think Heidelberg has a school of nursing, if I'm correct, and how they may be interested in working into this, the scholarship. And I'm speaking of that from the aspect that oftentimes people who go into nursing basically want to stay in their communities. Oftentimes it's a second profession for them. They're leaving one, going into something that they've always wanted to do but haven't had the opportunity until that particular time. I'm just throwing that out.
Okay, thank you, Polly. I'll go really fast, and then I think Robin wants to mention something. But we wanted to start with a partner in our 3 counties, and really the only one that we felt can help us immediately will be Heidelberg University. In addition to that, as I mentioned, I just don't think we have the financial resources to create a big impact if we're gonna spread and try to work with 3 or 4 different educational institutions. But that's a good point, that if we might want to look at expanding to some of the nursing programs at other educational institutions. That's a good point.
And the only thing I would add to that is I think it's a really good idea for us to explore that. But I do know for Firelands, they do like to have nurses in counseling positions. The struggle they run into is they need those nurses to be the RNs, and the reimbursement for counseling services and the payout to have an RN has not always been affordable for Firelands. And so that's just, something they run into. Nurses cost more than what an LPCC or an LISW costs. So.
Mhm.
But there are some great nurses who end up in the behavioral health field and definitely want to work with that population. So it's something for us to look into.
Other questions? Did we answer your question, Polly?
Yes, I thank you very much. This is a big project. It takes enormous amount of work. I understand that.
And one more item that I wrote down, I didn't put in an agenda. You know, sometimes I duplicate things between the two committees to make sure I don't forget stuff. But one thing I want to mention, just in case you don't listen to the minutes of the admin committee, and if you do, the first item on agenda is probably of most important. Uh, we are working with New Housing Ohio to develop independent living apartments, supportive housing for individuals with mental illness. And they are looking at a 18-unit facility in Fostoria. They are planning to close on it by the end of this calendar year, and they are planning major renovations to be completed in calendar year 2021. They are planning to work, I should say, with many funding sources to be able to recoup some of the cost of purchasing as well as renovations of this facility. Obviously, they want our support, and they want us as a partner. New Housing Ohio is really our housing provider. We brought them, I guess, into our community around 25 years ago or so when we developed 2 mental health group homes. They also started a homeless shelter in Seneca County, and I believe around 7 years ago they started the recovery house in Seneca County. So we have 3 other projects that we work with them directly that's housing related. So now the admin committee meeting, we had the president and CEO of New Housing Ohio, as well as their fiscal CFO, engaged with our admin committee for around 45 minutes. And the recommendation will be that we as a board will loan them $170,000 for an 18-month period to be able to close on this project on time. As they obtain some of the grants within 18 months, they will have to reimburse the funds back to the board. So really, it's not a capital investment from our end as much as it's just a loan to this agency. And then once they start accepting clients, which they project probably February or March of next year will be the earliest, their plan is to renovate 1 unit at a time and slowly bring in some clients. They will work with us on subsidies, and then they will apply for various subsidies they have a lot of expertise in to try to replace some of our subsidy match with others. And the way they present it is that the subsidy will kind of follow the unit and not the individual. And once they obtain a subsidy, I mean, it's pretty difficult to lose it. But if this other big project, if we are able to complete this and implement this in the next 18 months, this will be another one of those pie in the skies that we thought about it 5 years ago, but never had the financial means or resources to do it. And I believe we are on track to expand mental health housing for our clients in the board district. So we are very excited about this, and these apartments will also be open for individuals in recovery, let's say a step down from a recovery house to independent living. Robin, anything you want to add?
We did ask some questions of Scott Boone from New Housing, particularly, the location and will people have access to treatment and stores, and he felt comfortable that it was in a location where they would be able to make sure people had access to what they needed. Also, we asked about the good neighbor issues and the not in my backyard, and he is well experienced with putting up units where sometimes the neighbors are not necessarily pleased. He's not 100% certain what he'll get there, but he's experienced with handling that should he encounter that.
One other item that was discussed was ensuring that obviously the board clients have top priority in accessing these apartments, and that will be the case. Robin, I don't know if you want to give the example of the stepping up meeting that we had around a month ago with all the state individuals and all the local leaders, including sheriff, commissioners, and all that, and the experience we had with some of our clients with a different housing development, and how this housing development we actually believe they're going to serve our clients instead of refusing them.
So during that meeting, one of the presenters who was focusing on housing did acknowledge the challenge with having safe, decent, affordable housing for our population, and was excited to announce a unit that was going up in Tiffin and how this could help our population. And at the time, I wasn't aware, but afterwards, I found out that 3 of our persons in recovery had applied there and actually were denied because of their background. Now, I don't have details as far as their criminal background and what specifically about that they were denied. But it wasn't a unit that those 3 individuals could tap into. And I do know with working with Firelands and their housing assistance program that they too struggle with landlords who, will work with our individuals because they don't always have the best backgrounds. And, landlords, if they've had one bad experience, they apply that to the entire population. And so my question to Scott was, what will you do differently? And, he shared that, they're here to serve our population. So, unless somebody had a severe arson background, they might have to look at that differently. But as a landlord, they tend to look past those issues that our current landlords in our community hold and therefore do not, they're not willing to rent to our population a lot of times.
One more thing, do you want to mention about the 30% client portions towards the subsidy, towards rent?
So I believe what Scott was sharing there is because of the potential loans that he would be receiving in the future, he's required that he cannot charge more than 30% of the person's income for their housing. And so obviously he's got to make up some difference there, but he's got to help make this affordable based on, the low incomes that most of them would come in with. And so at some point he may look to the board to help make up the difference so he can make this affordable for the potential people that move in there that have mental health or addiction issues.
I had one question on that. And basically, with this housing, is there a case management component, or is there a possibility to tie into a case management component? Because once we have the case management piece, we find that basically helps a great deal for the person living within the housing. It makes it just more sustainable for all the residents.
Right now, the house itself would not come directly with that case management service. I do believe they will have staff. I think he said staff would be on site on a daily basis. Now, he did not say 24/7, but staff would be available. But NHO is, they've had, I think he said 18 years, which kind of threw me off. I didn't realize it had been that long, but they've been in our community working with our providers, particularly Firelands, who provides the case management service for the individuals who are in the recovery home, the homeless shelter, and the group home. So they would not directly provide that right now unless we came up with a different plan down the road, but they would receive those services through the treatment agencies.
Hi, this is Pam. I used to work in it was called an SLA, single living arrangement for DD. And we used to get apartments for them around the city. And then we would have a quote social worker or case manager assigned to this apartment, that apartment, this apartment. And they would go in once or twice a week, look at everything, and a lot of times do the socialization, take them to a dance or whatever, take them to the grocery, take them to the bank, that kind of thing, so that you had control over the people in those apartments. And the landlords loved it because, one, they can get full rent, and two, there's somebody to watch out, instead of they don't have any need to watch out for people. So it went really, really well. I mean, we had at one time maybe 30 apartments in the communities up in DuPage County out of Chicago. So it really does work well, but there's different ways you can put it together.
Mhm.
So I know it's almost 6:00 and you guys want to go, but sometime we can talk about different things, or I can talk with the housing people about different options that worked really well for years. And that 1/3 of the housing cost is called Section 236 of the federal government. It's not a Section 8 where you give a certificate to the person and then charge them very little. It's Section 236 where the landlord will, I hate to say wait, but get 1/3 of the price from the claimant and 2/3 from, the government. So, and that works really well too. So that, and also quickly, the people, the neighbors feel more confident if there's a 236 involved. They feel more confident if there's a quote social worker, assigned to all these different people. So we can talk about it sometime. It's an interesting program.
No, very,
It's called SLA. It's an independent living organization.
very, very good points, Pamela. Actually, no, that's why I wanted to bring this up. I know you and Polly might really be interested in this. And New Housing Ohio, I think they are also in search of a regional director, which I think will also oversee this project. So when that person is in place, I'm planning to invite them to one of our board meetings or committee meetings. So you guys will interact with them and then answer questions, give them some advice and suggestions. I'm also planning that once they purchase the facility and they start renovations, maybe for us to do a tour of the facility, and then obviously be able to meet with Scott, the CEO, and and some of their workers and ask all these questions and again provide some suggestions. So if we have to do it in separate groups because of the pandemic, we will do it. But the goal is early next year for all of you guys to have again opportunity to rediscuss this with the agency as well as see the facility.
You just made one error, though. You said when he gets hired, the executive director, it could be a she.
Oh, I said that. I gotta go back and cut the recording and re-record again, okay? Yeah, it could be a she. Very good point. I don't even know if they started the process yet to look, but I know they are in search of a regional director. Okay. Any other questions or discussions about anything we talked tonight? Pamela, I want you to know that since I've been here at the board, and I believe since NHO came to our community, they had only female directors, you know, so I was trying for a change. I was looking for a change. I was trying to help them out.
Trying to justify it. That's okay. I'm just giving you a hard time.
That's all right. I'm trying to think what are the updates. I will send you guys the location and some of the pictures from the facility, maybe with the board mailing package of Friday. I made a note. I guess the only other thing I want to bring up is we did bring it up a little bit on Monday night. I'm not sure how much we want to talk about this, but in Fremont and Sandusky County, there has been a group of individuals call themselves Dead Against Predators. And really what they were doing, or probably still doing, I'm not sure, they were luring on various chat websites individuals and acting as minors, and either minor girls or boys, and were trying to plan a meeting with them, either in a public or maybe sometimes private locations, because I believe they had a few that they lured them to various houses, and then I guess exposing them, videotaping them, and exposing them as predators. And then, you know, they were blasting all these videos on YouTube, Facebook, social media. The only reason I'm bringing this up around, I believe, was 10 days ago, and actually I ran into Marcus that day. I was called for an emergency meeting at the city building in Fremont with the mayor, county prosecutor, city law director, a few chief of police, the sheriff, because they really wanted the board to partner with them when it comes to trauma care and mental health support services for some of people identified. And one thing that they mentioned to me was that at least two, but they were projecting maybe three, but at least two of the individuals they were, I guess, so-called exposed by this DAP group in the last 6 months, they have completed suicide pretty much in a very short period of time after the video was released to the public, or after they were exposed. So obviously this has increased suicides in our board district. This is a concern. I know law enforcement and county and city law directors are trying to put a stop to this in this fashion, the way it's happening today. You shouldn't be surprised when I say that community feedback, though, it appears that 90% of the community is actually agreeing with the practices of this group. I'm not here to criticize or not criticize that. I'm here just to talk about our portion, which is the behavioral health portion. So I did commit it to the law enforcement agencies, the prosecutors, that when they identify these trauma victims, we will immediately work with them and put them as a priority and make all the arrangements necessary for them to be seen. So really that's just our portion of that. If you have questions, I can answer. People in Fremont and Sandusky County, such as Marcus, they probably know even more than what I know about it. Last another thing related to this, 2020 numbers for overdose and suicides we project to be the highest in Ohio's history, both of overdoses and suicides. So if you actually you won't see that officially until fall of 2021, but just that is the projection. You'll probably see coming up very soon the 2019 numbers, which also will be higher than 18. So that's an increase, but they project 2020 to be the highest we have ever seen. And the last thing, do you guys have any questions about what I just talked or comments, Marcus?
I mean, I'm not going to comment on it too much. A question be related to the numbers that may come out next year. Would those be in correlation to the effects of COVID?
Very good question, Mark. I don't know how Ohio Department of Health or anybody can say. I don't know how we can correlate it directly to COVID. I think there will be a lot of assumptions that some were COVID related. I think that there's already a lot of discussion in the recovery community that overdoses are really increasing due to the fact that a lot of recovery support groups were canceled face-to-face due to COVID. So I think there will be a lot of assumptions, I guess, or projections why the numbers are so high, but I'm not sure if one can correlate them directly to COVID.
Okay.
And Mircha, last time you had said to watch Social Dilemma. That is a really good one to watch if you guys haven't watched that on Netflix.
Yes, and again, if you don't have Netflix and you want to stop in by the board office for even if you just look the first half an hour or so, 45 minutes,
Yeah.
please come in. We'll make the arrangements for you to see. But it's actually what's interesting that Social Dilemma Netflix, whatever you call it, documentary, actually directly relates to the suicide attempt data that I shared with you guys around 45 days ago. As I said before, the state of Ohio is keeping track of suicide attempts data that are happening at the local emergency rooms. And the number one age group for attempts in Ohio right now is 10 to 19-year-olds, which again, it directly correlates to the Netflix documentary and what you see there. And was really an eye-opening. I think I read the report and saw the documentary within 72 hours. And I just couldn't believe it how much it actually correlates.
Yeah, it was definitely an eye-opener. Kind of scary.
Any other questions about anything? And last, as I mentioned earlier, we continue to have our publics virtual and also open to the public. The public will receive notification about the phone number to the meeting so they can call in. We will probably not give the WebEx link only to board members or some of our providers. And the reason why there have been a few public agencies across the state of Ohio, especially the ones that use Zoom, there were what's called Zoom bomb. I don't know if you heard about that they had people that were not supposed to be in the meeting join the meeting and disrupted the meeting in very unprofessional ways. And we actually had one of the mental health boards here in Ohio, actually two of them, they were what's called Zoom bomb to the point that they almost had to immediately terminate the meeting. Fortunately, I think we have it covered. But again, that's why we're probably not going to share the link unless we identify the people who shared the link with. But because we have to follow Ohio Open Meeting law, we will have to give everybody a phone number, but we can manage that because we are able to mute them. Any questions about that? Do you guys heard about the Zoom bomb thing that's happening sometimes a little bit? Okay. All right, any other final thoughts?
Nope. People have too much time on their hands.
Yes, they do. Okay, it's 5:58, 59 according to my time. I'm going to stop the recording. Thank you, everybody. We'll send the board mailing on Friday, and we'll see you guys all next Thursday. Thank you very much.
Thanks, Mircha. Have a good one.